Hello, everybody. This is Kim from St. Mark's Hospital. Thank you for coming today. Our presentation is on HPV and cancer for both men and women. Our speaker is Danielle Wright, and I'm going to let her introduce herself. Thank you. You can go ahead and start, Danielle.
All right. Hi everybody, my name is Danny. I am one of the nurse navigators up in the cancer support department at St. Mark's here. And I'm actually filling in for one of our other navigators. She pretty much did all of the research for this presentation, so I have to give her a little bit of credit. So thank you, Jenny. But I will go ahead and get started with our presentation. So we're going to talk about HPV and cancer. By the end of this, let's see, we're hoping that you're going to be able to define HPV and the risks that are associated with it, the cancers that it can cause, and what methods of screening and what you can do in order to help stay healthy and either prevent or catch this early on. So HPV stands for the human papillomavirus. You've probably heard of it, and a lot of you probably have already heard that it is has to do with cancers. Specifically, cervical cancer is probably the one that you've most heard of. However, it is the most commonly transmitted sexual infection in the United States. There's a bunch of different kinds. There's over 100 kinds of it, and about half of those are spread through direct sexual contact. There's a good likelihood that you've had it in your lifetime. A lot of people don't even know they've been infected, that they have it, that they had it, and they either clear it or sometimes it can go on to develop cancer though. All right, so what HPV doesn't necessarily, just getting it doesn't mean that you are going to get cancer. What it does is once it infects the cells, once it's inside the cells, it causes some changes, and sometimes those cells can't recover from that. So they can't make the corrections that they need as they continue to replicate, and pretty soon they are just replicating cancer cells. So a lot of the HPV-associated cancers do have a pretty good cure rate if they are caught early. And so like I was saying again, even if you've haven't been sexually active for years, you've only had a limited number of partners, you still could have HPV, and you may not even have any signs or symptoms of it. You can't get it from from toilet seats or from hugging, holding hands, hot tubs, those kind of myths that you hear for all sexually transmitted infections, unfortunately. So, all right, so the kind of cancers that it can cause, there's 6 main types of cancer: cervical, vaginal, and vulvar in women, and then penile cancer in men. Anal cancer can also occur in both men and women, that is HPV related. And then also the oropharyngeal cancer is what it's called, and that's the back of the throat, back of the tongue, and that can also be an HPV caused cancer. So as you can see, when you can get it through having sex, and if somebody that you're having sex with has it, and even if they don't have any signs or symptoms, you can become infected. So it can silently be spread, and that's one of the reasons why it's so common. So from those types of cancers, the big 31% gray piece on this graph represents the cervical cancers. But as you can see, 39% of HPV-related cancers are that oropharyngeal this day and age. So cervical cancer used to be number 1, and now oropharyngeal has kind of taken over. And the other bigger chunk of that is anal cancers. So where is the oropharynx? It's kind of a strange word. Basically, it's the back of your mouth. It's the back of your tongue, your soft palate, um, back your tonsils, your lymph nodes, that area at the back of your throat. So this, I guess, area of cancer is probably kind of alarming to some people. They might not think that they might not have thought of this right away. It does take about 10 to 20 years after you've been infected in order for the cancer to develop. So, this is something that you don't get overnight or even within a year. This is something that has been kind of growing or starting for a long period of time. And a lot of times, this is also kind of a region that up until, oh gosh, probably the past 10 years, a lot of these cancers were were caused by smoking because the incidence of smoking was higher. And now that the incidence of smoking has gone down, we're not necessarily seeing a decrease in the number of cancers of oropharyngeal cancers, but we are seeing an uptick in the number of them being caused by HPV. It's the HPV in general is, or HPV in the back of the throat in the oropharyngeal area is more common in men than it is in women. And it's actually the most common group of people is heterosexual males in their 40s and 50s. So it can be very difficult to determine, whether or not it's cancer just based on symptoms, because a lot of the symptoms are very vague. You can have a dull sore throat that just lasts for a really long time. Your lymph nodes can be swollen and pain when you swallow, or unexplained weight loss because you're not don't want to swallow, don't want to eat, or earaches because of those enlarged lymph nodes and the processes that are going on in the back of your throat. So how can you even determine whether, I mean, you can't necessarily see the back of your throat always, but it's an area of your body that's constantly working. You're swallowing, you're talking, all of that can remind you of that you have an issue, that you're having a sore throat or whatever, but it's how can you treat that? It's pretty difficult to treat, and it involves kind of a trifecta of surgery, radiation, and chemotherapy. And as you can imagine, though, when you start looking at doing any of those three modalities in the back of your throat, it's going to be difficult to continue to eat, to continue to maintain your quality of life, because that's kind of a tough area. The other thing with surgeries and radiation is it can also be quite disfiguring. You've seen probably the commercials on TV about the smokers and with the disfiguring effects left after their treatment, which can be the same issues. You can have those same effects from treatment for HPV related cancers in the oropharyngeal area. There's not any approved screening. You can't have a blood test or something like that that's going to determine whether or not you have a cancer related to HPV. However, they can be caught early in a lot of cases, and this is through just a physical exam. This picture reminds me of going to the dentist, and I mean, when they're pulling your tongue out and looking at it and you're like, why are they doing all of this? Well, it's because they're looking for subtle changes to the tissue that could indicate that you may have cancer. So early detection, lots of screening, and that's if that's going to be the best and quickest way to catch this at a stage that's treatable. So moving on to cervical cancer, the second leading cause of second HPV caused cancers. It is the fourth most common cancer for women worldwide, and virtually all cervical cancers are caused by HPV. The good news is that if it's caught early, it can typically be treated and cured. So that's the good thing about it. Bad thing is that's not always the case. As far as screening for cervical cancer goes, this slide is just, it's quite busy, but it just shows you that there's, between the different professional groups, there's not a general consensus on exactly what to do. Everybody's got their own kind of opinion, but really it all comes down to one thing, and that is regular screening. Generally, the screening guidelines exist to detect precancers or cancers early on so that they have the best outcome for treatment. HPV testing is typically done at the same time as a pap smear. They just do, when they're in there doing one swab, they usually just do another swab, and then they can take those, all of those results combined and kind of get an idea of what your risk is for developing cervical cancer. If when they do that swab, they find out that your HPV test is positive, it doesn't necessarily mean that you are going right into any sort of treatment or something like that. It could just mean that they're going to watch and wait, do a little more frequent exams on you. They can do some additional testing, some different procedures that can kind of take out those abnormal cells quickly so that it doesn't become a cancer. So there's lots of different ways. Really, again, screening is the ultimate the thing that you should do in order to help prevent some serious cervical cancer. All right, so signs and symptoms of cervical cancer. Again, the big thing is if you're having bleeding between periods or bleeding after you have experienced menopause, that's abnormal. That should be looked at right away. Painful intercourse, heavy bleeding or discharge, and sometimes it can just present as some back or pelvic pain. Typically that's reserved for more advanced cases. So a lot of times it's going to be abnormal bleeding. Okay, so HPV in men, it's not usually something that is thought about, that men can get cancers from HPV. However, some men are more prone to developing a cancer, even though from an HPV infection, especially those with a weakened immune system, like those people who have HIV or another condition in which their immune system is not quite up to snuff. Men who receive anal sex are also more likely to get anal HPV and subsequent anal cancers. And but basically for men, it's often very, very silent. They don't know that they have the infection. You hear about genital warts, but those really aren't the kind of HPV that cause cancer. The ones that cause cancer, you probably don't even know that you've been infected with. So other than anal cancer, there's also penile cancer. Again, tissue changes, thickening, buildup on the penis, or painful and or painless sores actually that can occur, could indicate an HPV infection. They could be bleeding, they could just be kind of raised areas of skin. All right, and on to anal cancers. Again, these symptoms are very similar to those that you might think of. You might just blow it off as hemorrhoids, but you can have change in your bowels or change in the shape of your stools due to swelling of lymph nodes in the anal area or even into your groin. And then pain, fullness, or incontinence can also occur. The one thing that is starting to become more common is physicians are starting to use the same testing that they do on the pap smears for women. They're starting to use that same test for screening for anal cancers. They can just swab around the anus and test that for HPV to see if there's precancerous cells in the area, to lead to quicker and earlier treatment. It's not an established standard yet, but more and more providers are actually doing it. All right, so there's about 39,000 cases of HPV associated cancers diagnosed each year, and about 9,000 of them are anal cancer. From those, about 2/3 are in women and 1/3 of them are in men, and about 1,500 deaths also occur just from anal cancer alone. So what can you do? Obviously, since this is a sexually transmitted infection, you can practice safe sex, limit the number of sexual partners, use condoms. Again, it's difficult because a lot of these cancers you could have been infected 10, 20 years ago and are just now finding out that you have cellular changes related to that infection. So also education for teenagers who are just becoming sexually active is also very important. There's also the vaccinations. HPV vaccines are very effective in preventing HPV-related cervical cancers. And again, screening, just like every other cancer out there, screening is the best thing that you can do in order to catch it early and prevent any complications. So the HPV vaccine, it's fairly new for those of us who are older, but it is the best. It's highly effective. Still, the best prevention is practicing safe sex, but the HPV vaccine is a good addition to that as well. It became available in 2006, and although there's over 100 types of HPV infections, the HPV vaccine prevents it covers the spectrum of those that are cancer causing. So it can prevent up to 90% of all HPV related cancers. It's, again, as we've talked about, this isn't just a disease for women, it's a disease for men and women, and it's shareable. So it's important for both men and women, boys and girls, to get vaccinated. All right, so we've talked about that there's over 100 types. It's really only about 10% of the HPV strains that can cause cancer. But from these numbers, you can see that getting the vaccine is imperative these days to helping prevent. It's easy to do, and it's for kids in the future. It's going to be very beneficial for their health. So the vaccination schedule. The WHO, the World Health Organization, recommends that it just is now a part of all childhood vaccinations. They like to start them early on, about between the ages of 9 to 12. And a lot of that is because their immune system is very robust, and they're going to create a lot of antibodies by giving them at that age. Again, the other thing is that a lot of them are not sexually active, so you're going to catch it prior to any chance of infection happening. It's 2 shots that's given over about a 6 to 12 month period. And as you get older, then they do recommend that you get a third shot. So it's actually a 3-shot series once you get into your mid-teens. And the other thing with this is that there's now, there's been a move now to not just give it to, when it first came out, they were just giving it to teenagers. And then, you know, once you were through your teenage years, they didn't think that it was worth getting the vaccine anymore. But there are some clinics now that are starting to offer it to older populations of people. One of the big ones is men who have sex with men. Some clinics are offering it up to the age of 45 for them. HPV and relationships. So this can be tricky. I mean, it's like all sexually transmitted infections. You know, when one partner is diagnosed, you know, sometimes the first thought goes to infidelity. You know, but I think it's important to know that HPV can have been present for a long time, and it's unknown, you know, in a relationship whether which partner gave it to who. You know, it's easily transmissible, so it doesn't necessarily mean that somebody's having sex outside of a relationship. It's just important to keep that communication open and have those discussions with your partner should this come up. Now, while many sexually transmitted infections can lead to infertility if they're untreated, and HPV doesn't necessarily cause infertility in men and women. However, the procedures that are used to remove the precancerous or cancerous tissue from the cervix can lead to scarring and what can be called an incompetent cervix, meaning it's difficult for a woman to maintain a pregnancy. There's a higher risk for preterm births with it. So it is important to be diagnosed and to catch it before large amounts of your cervix have to be treated. So how do you cope with HPV? There is still a stigma out there, and most people know now that HPV causes cancers, so it can be scary. A lot of women who have been diagnosed have high levels of shame and anxiety because they've tested positive for this virus, and they don't know when they got it, they don't know where they got it, and it's a virus, it's a disease that needs to be normalized in order to make it less distressing for people. In fact, when analysis has been done on patients with HPV, they've identified the number one stigma is a negative self-image. So things that you can do, you know, just watch your stress level, communicate. There should not be a stigma associated with it. Open communication is key. Seek support from your friends, your family, and quit smoking. Just quit smoking in general, I guess. Doctors don't always tell their patients that their cancer has been caused by HPV. You know, a physician may just say you have anal cancer, or you have oropharyngeal cancer. Because of that stigma, it can cause additional distress between partners. You know, there may be, again, that added layer of, you know, you were unfaithful to me on top of, you know, you have cancer. So sometimes they actually just don't even tell their patients, and kind of just sweep that part of it under the rug. It's becoming less common now. Physicians are opening up. Again, that stigma is hopefully going away, but it is still out there, that it is just kind of kept in the shadows. So hopefully one day we'll get past that and we'll get better screening and better outcomes for HPV related cancers. All right, does anybody have any questions for me?
Sorry, I was answering something. I have a question. With HPV, is there chemo and or radiation associated with treatment?
Yes. Yep. A lot of times they will do, depending on the location of the cancer, a lot of times if it's in an advanced stage in the oropharyngeal area, they will do chemotherapy and or radiation prior to surgery, in order to try to spare some of the disfigurement of resections. So, yeah.
And maybe you said this and I just didn't hear it. Let's say that a woman does have HPV. Um, how big of a chance is it that has given that to her partner?
It's if they are, it's easily transmittable. So it's highly likely, extremely high. I would say 95% chance.
Okay. So here's a really stupid question that I saw on TV last night. So it's, one of those drama things where the mother apparently had cervical cancer and during delivery had given it to her children. How really is that possible? Is that really something that's possible?
So if she had cervical cancer, she's not going to give it to her children. You can have an HPV infection can be transmitted to a newborn through birth, but it's pretty uncommon. I mean, there has to be a lot of factors. All the things have to line up in order for that to happen. It's not something that's common, but they will not. You can't transmit cancer, so it's not going to be. Yeah, that didn't happen.
Yeah, that's what I thought. I thought that was way out of line for that TV show, but just thought I would ask. So one of the questions is, how effective is treatment?
It depends on the stage, how early they catch it. If it is caught early in a precancerous stage, um, uh, the procedures that they can do can eradicate the cancerous cells, and it's extremely treatable. You go on about living your life. If it gets into the later stages, it can spread. It can metastasize, meaning spread to different organs, in the area, or even in advanced cases to distant areas of the body, and then it's much more difficult to treat.
Okay. Everyone, if you would like to type in a question in the chat box, Danny will be glad to answer those. So we'll give everybody just a few seconds, Danny, to see if there's any other questions or if I'm coming up with any.
Okay.
So while we're waiting, is condoms, is that really effective in reducing HPV?
Yes. It is. It can be, like all sexually transmitted infections, body fluids can be a big cause of it. So if there's a barrier between those body fluids, it can help.
Okay. And what about douching? I know that sounds like a horrible word, but somebody may have that question out there.
Yeah, I would say that's not going to be terribly effective. There's, for a lot of different reasons, douching just isn't advised in general. because of the changes in pH that it can cause and the issues that it can cause for women. So that's not a good prevention for it.
Okay. Does it affect pregnancy or labor at all?
So again, if a woman has HPV, if it's untreated, if there's enough damage done to the cervix can, or if the woman even has had treatment, um, meaning they've gone in and they've kind of done some procedures to take off some of those cells off of the cervix that are cancerous. If the cervix is thin or has scarred enough, or if there's a lot of disease on it and it is not able to keep closed, then you can have preterm uh, labor and birth.
Great. Someone asked, can the vaccine help prevent cancer later?
So that's an area that is kind of under study right now, you could say. There, oh, it used to be that they didn't think the medical minds just kind of assumed that once were past your teenage years, the majority of people had HPV already, and it was not worth giving them the vaccine. Now they're finding that it could have some benefit to give it to people later in life. It has Part of that has to do with, as you get older, your immune system isn't quite as robust, so you don't develop those antibodies and not as great as you did when you were younger. So there's thoughts that it's not as effective to give it later, and that also, a lot of people have already been infected with HPV, and that if there's going to be long-term tissue changes and development of cancers, then that's already in process.
Okay. Next question is, for surgical treatment, are hysterectomies required?
No. If the cancer is just located on the cervix, they will do procedures to just remove those cells from the cervix. They can also do chemotherapy and radiation but the radiation can be more directed to the cervix. So if you have it, it does not necessarily mean that you're going to have a hysterectomy. If the cancer has spread, further, then that is a possibility, but in early stages, no.
Great. Okay, any other questions coming up for anybody that? Is it true that getting your tubes tied helps prevent cervical cancer?
No. If it's you still are going to have your cervix is still there. And if you have an HPV infection, you could, you have the potential, regardless of having your tubes tied or not.
Great. Let's wait another few more seconds to see if anybody else has something they'd like to ask. So Danny, do you think it's important? I'm sure you do, but I just want to kind of restate this, that the vaccine is given to younger teenagers, both male and female. I know for a long time they were just talking about the young girls getting them, but hasn't the last couple of years they've really been stressing that the males do also?
Absolutely. It's not only because if you, as a male, if you're having sex with a woman and you don't have HPV, you can't give her HPV. So there's that level of protection against cervical cancer, but also the incidence of oropharyngeal cancer has increased, and that's a cancer of men and women, along with anal cancer. We see that more than the general public, I think, thinks.
Yeah, I was actually quite surprised when I had my dental visit recently that that's what they were looking for that, and they explained
Yeah.
that to me. I thought that was really pretty interesting.
Yeah.
With a lot of vaccines right now, we hear a lot about side effects. They're hurting, you get a fever, you don't feel good. Is there any kind of side effects that you would like everybody to know about, or let them know that there are no side effects?
There's really not a lot of side, I mean, other than if you take your child in to get this, they're gonna tell you that their arm is incredibly sore, like all other vaccines. But it's an attenuated virus. They shouldn't have any real side effects from it, other than the sore arm. It's not likely to cause the low-grade fever or anything like that that you get from some of the live viruses like MMR or chickenpox. Um, it's an attenuated virus. It's kind of like the flu shot. So some people say they get the flu from the flu shot. You're not going to get HPV from the HPV vaccine, but you can you shouldn't have any trouble.
Great, thank you. Thank you. I haven't seen another one come up. I know that Brittany Perry wanted to put a link on. So Brittany, if you want to do that for Salt Lake County so that they can get some credit, now would be the time to do that. And if not, then you can contact Brittany Perry at her email at Salt Lake County and let her know that you attended. Hey, Danny, I've not seen any other questions. Is there anything you would like to close with?
Thank you all for your time, and yeah, keep up the screenings.
Great. Thanks, Danny. I appreciate it.
Yeah.
And for everybody else, I will be sending the PowerPoint in a PDF and the recording to your health advisors, and they can send that out to you if you have any other questions. Thank you, everyone, and we'll get together again soon.